Hello, my name is Corinne Peek-Asa, and I'm the Associate Dean for Research at the College of Public Health here at the University of Iowa, and I direct the Injury Prevention Research Center. It's a wonderful honor to be chosen to give the presidential lecture in 2020. It is great to represent the work I do, but also the work of my interdisciplinary team, and be able to tell Iowa all the work we're doing to try to reduce the burden of trauma. My presidential lecture is titled Violence, Syndemics, and the Biology of Trauma. It focuses on our increasing knowledge about how adverse child experiences impact long-term health outcomes. I'm using the framework of a syndemic to help us think about how to prevent these outcomes. A syndemic is a cluster of epidemics. So it's health outcomes like substance use, violence, and suicide that have underlying causal factors like adverse child experiences, but that also recognizes that there are structural factors like poverty, lack of access to resources that are really important. One helpful thing in the framework of syndemics in prevention is that the syndemic framework focuses on the system. It doesn't focus on one specific disease. So in my lecture, I'll give some examples of how we can focus on systems like the workplace, like communities, to think broadly about interventions that can impact multiple health outcomes, recognizing that child adversity can be an underlying factor.